Welcome, friends. Revise with me homeopathic remedy Glonine. This is part 7 clinical correlation. And this is a applied materia medica also. And the text is from Ellen's keynote. And this is a very good study for BHMS students of homeopathy, interns, and MD students also. I am Dr. V.K. Chauhan, homeopathic physician. So let us go to the first PQR or the first sentence given in the Ellen's keynote about Glonine is nervous temperament, plethoric, florid, sensitive woman, person easily affected. Here it gives the constitution, and in constitution he talks about the temperament of the patient, and second part he talks about the physical attributes of the Glonine patient, that is florid, plethoric, sensitive female. So let us first go towards the temperament. The temperament is a unique expression of an individual. It represents the state or disposition of the person, and it is a form of reaction of an individual towards external or internal stimuli. These reactions depend on the past experiences of the individual. And from the psychological point of view, we can understand that this is a learned behavior. The nervous temperaments, the attributes of the nervous temperament are represented as under. These individuals get easily agitated or alarmed. They are anxious persons. They feel nervous, restless, or tense, and having a sense of impending danger, panic, or doom. They have increased heart rate because their sympathetic nervous system is stimulated. Similarly, they breathe rapidly. We know it as hyperventilation, and sweating is also more because it is a sympathetic autonomic nervous system which is supplying the cutaneous aspect, activates the sweat glands, and trembling is also because of the high sympathetic tone here. They feel weak and tired. They have difficulty in concentrating or thinking about anything other than the present worry. They are so engrossed in their anticipatory anxiety, and it all makes them very much prone to anxiety disorders. So let us go to the florid, plethoric, sensitive woman. You will find many conditions attributed to similar features in a female. The number one of the condition is rosacea. Rosacea is characterized by dilatation of the peripheral facial blood vessels, giving the cheek and nose a flushed appearance. Rosacea is a vascular disorder, and it is predominantly affecting the flush area of the face, which manifests persisting erythema, telangiectasis, and punctuated with episodes of inflammation. The location or area affected includes the central region of the face is mostly affected, and they include the cheeks, the nose. Sometimes you will find the forehead or chin may also get affected. The very common symptomatic presentation is you will find it is a chronic disorder, onset is insidious, and the frequent flushing is very common. Persisting erythema is there. Telangiectasis, you will find the fine capillary dilatations are present over there, and in between there is a episode of formation of acneiform papules and pustules, which are visible in this particular diagram, or you can say photograph, very clearly. The florid plethoric part is also very much commonly seen in cases of polycythemia rubra vera. Polycythemia, it is characterized by an increased number of erythrocytes in the blood, thereby raising the hemoglobin concentration above the upper limits of normal. And usually they are approximately hemoglobin is more than 22 grams per deciliter. The cause of polycythemia, we can go to the primary cause, which is because of mutation in JAK2 gene, and then secondary causes are because of the tissue hypoxia, and it is usually because of the some kidney disease. The sign symptoms include fatigue, headache, dizziness, episodes of blurred vision. There is a peripheral tingling, burning, and itching is very common with this. Hypertension is common. Mucosal cyanosis is also very common. Bruising, petechial hemorrhages are there. Spleen and liver is enlarged. General management, of course, we go for phlebotomy and plenty of fluids. Allopathic treatment includes aspirin, myelosuppressive medication. So here the RBC are more, it is a kind of cancer. Let us go to the another feature of plethoric florid kind of a presentation, that is Cushing syndrome. In Cushing syndrome, the most commonly it is caused due to the excess of cortisol, or you can say prednisolone. Sometimes or most of the time you will find it is iatrogenic because of the patient is taking some medication in the form of prednisolone, or rarely you will find because of tumor like pituitary adenoma, which can result in excessive cortisol. This is a classical presentation what you see in Cushing syndrome. There is a fullness of the supraclavicular fossas because there is lot of deposition of the fat pad in the supraclavicular fossa. Patient do develop osteoporosis. Hypertension is very common. Muscle wasting of the extremities, the upper extremity as well as the lower extremity, they are very thin. And the somewhere in Davidson it was described as the lemon on sticks. So that is what the appearance is. Poor wound healing is there. You will find mooning of face, dark facial hairs. So you have unwanted facial hairs there, and cardiac hypertrophy, obesity, central obesity we have, and abdominal stria are very classical kind of a thing, and amenorrhea is also classical. We'll again see in elaboration what are the classical presentation of Cushing syndrome. You will find upper body obesity with thin arms and legs, buffalo hump, red round face. You will find high blood sugar is there, BP is raised, vertigo can be there, blurred vision, acneiform eruptions, and female type of hair loss. We have it is kind of alopecia androgenetica, which we find in males has a different patient pattern, but in female you will have a different pattern, female balding. Water retention you will find menstrual irregularities are common. The skin is very thin and bruising easily. Purple stria is very commonly and very subtle kind of a sign of this particular Cushing syndrome. Poor wound healing, hirsutism, severe depression, cognitive difficulties, emotional instability, sleep disorders, and fatigue are the common features you will come across. Now we go to the bad effects of mental excitement, fright, fear, mechanical injuries, and their consequences from having their hair cut. So there are two components in PQR2. It is the second line or second sentence in the Elensky note. It tells about the mental excitement, and then he tells us about the physical problems because of the haircut. So let us go to first the bad effects of mental excitement, fear, fright. You will find the acute phase of anxiety reactions, panic attacks, reactive depression. The chronic phase is where you will find post-traumatic stress disorders, etc. So physical symptoms, there is an increased heart rate, faster breathing, fright or fight responses are there, increased blood pressure, as we have already discussed, include blood sugar, goosebumps, and sweating in the acute phase. And the mental symptoms you will find commonly there is agitation, irritation, anxiety, nervousness, headache, dizziness. This headache can be a tension headache, chest pain, tremors, muscle weakness, inability to sleep, and upper GIT upset like stomach pain and nausea, etc., can be present over there. Now we go to the bad effects of mechanical injuries and their consequences. So let us understand classically what the mechanical injuries are. Based on the causative factor, mechanical or physical injuries are one important group. Then there are thermal injuries because of the heat and cold injuries, chemical injuries, miscellaneous electrical radiation, lighting. We are not talking about all this. We are talking about the mechanical injuries. And most probably mechanical injuries you will come across the blunt trauma caused by blunt trauma like abrasions, bruises, contusions, lacerations, fracture, dislocation, concussion at times. And when it is caused by the sharp force, you will find incised wounds are there, stab wounds are there, and third physical injury is caused by the firearms, bullet injuries, etc. But we are concerned about the fracture, dislocation, and concussion only. The mechanical injuries and their consequences, we are going to have the say for head injury is there, then chronic subdural hematoma can be one of the very important things we should not miss. And second important thing is post concussion syndrome, which is very, very important. So, friends, we'll go for the symptoms of chronic subdural hematoma. We have persistent headache, dizziness, loss of balance, nausea and vomiting, fatigue, difficulty in speaking, lethargy, nervous system abnormalities like weakness in arms and legs can be there, memory loss can be there, personality changes, especially which you will find in cases of the elderly people. The concussion is a mild traumatic brain injury. Most concussion occur without losing consciousness, and the effect of trauma is trauma can cause vestibular dysfunction. There can be ongoing dizziness, vertigo, blurred vision, imbalance, fatigue, and falls. And there are symptoms which are like thinking difficulty, concentration and memory has problem. Emotionally, patient is irritable, maybe sad. Physical headache. Physically, you will find headache and dizziness is common. Sleep more or less than usual. And common causes you will find because of the fall is 41%. You are struck against something, 15% traffic accident, 14% assault includes 11% and others are 19%. So now we go to the bad effects of haircut. If you have the haircut, this event can be interpreted as loss of insulation to the neck and can result in exposure to heat of sun or the burning coal which acts as an exciting cause in cases of glonine. Now we go to the PQR3 is the third sentence in the Allen's keynote for glonine. Head troubles from working under gaslight when heat falls on the head, cannot bear heat about the head, heat of snow or walking in the sun aggravates. And another seventh sentence in the Allen's keynote for glonine is, which we talk in terms of the PQR7, children get sick in the evening when sitting before an open coal fire or falling asleep there. So PQR 3 and 7 insistently and predominantly talk about the troubles from working under gaslight or heat or sun. Symptoms of heat stress can range from mild heat rash or sunburn to severe heat exhaustion and heat stroke. Extremely high body temperature
can result in like hot, dry skin. There is a inability to cool the body through perspiration, and this may cause the skin to feel very high, dry. Increased heart and respiration rate as the blood pressure drops and the heart attempts to maintain the adequate circulation. Throbbing headache, nausea, vomiting, and due to dehydration most probably. And weakness, fatigue, dizziness, especially of standing. If the patient is standing, is assumed quickly due to low blood pressure from dehydration, and as the patient stands, he develops postural hypotension. Muscle cramps are there, dark colored urine because of dehydration. It is a high colored urine, highly concentrated urine. Patient is confused, hostile, or seemingly intoxicated behavior. There is a pale bluish skin in color in advanced cases due to the constricted blood vessels. Let us go to the PQR 4A and 4B. 4A tells us cerebral congestion or altered. There is a alternate congestion of the head and heart, and PQR 4B tells us head feels enormously large, as if skull were too small for brain. Sunstroke and sun headache increases and decreases every day with the sun. So sunstroke has got following features like we have got anxiety, confusion, skin is hot and dry, sodium and potassium depletion is there, impaired sweating, listlessness. If cerebral edema is there, then you will find the seizures, delirium, coma, and generally body temperature is raised more than 40.6 degrees centigrade or 105 Fahrenheit. Pulse rate is high, respiratory rate is high, and hypotension is common. So the standard protocol for management is the cooling, rest, and uh, giving him the body electrolyte support and fluid support. Now we go to the heat stroke. This is a most severe cause where the body temperature rises above 40 degrees centigrade. So already we have been talking about it. It is a nervous system abnormality which, if not treated in time, can affect the brain. And the symptoms of this stage includes absent-mindedness, loss of motor control, reduced brain function, nausea and vomiting. If not recognized in its early stage or treated properly, the patient can also slip into coma. Now we go to the PQR4C, terrific shock in the head, synchronous with the pulse, and PQR4D, throbbing pulsating headache, holds head with both hands, could not lie down, the pillow would beat. The PQR4E, brain feels too large, full, bursting, blood seems to be pumped upwards, throbs at every jar, step and pulse. These combined features point towards migraine. The migraine has throbbing headache, pain in the eyes, face, neck. The patient has got sensitivity up to light. He cannot tolerate light, noise, and smells, strong smells. Nausea, vomiting is there. Loss of appetite, upset stomach, fatigue, and dizziness is also there. The patient may feel warm or cold, and the skin may be pale. Let us see the phases of a migraine attack, how it comes in phases. Initially, there is a premonitory phase. It may be few days or few hours before the typical attack. Patient may have fatigue, cognitive difficulties, mood changes, food cravings, reason like neck reason has got pain, and patient may have yawning, unexplained yawning. And then the aura comes approximately 5 to 60 minutes before the acute attack. There can be visual aura, scatema, fortification spectrum. Sensory disturbances are there, speech disturbance or motor disturbance. It can be anything, which is followed by the classical headache, which may remain there for 4 hours to 72 hours. Headache with nausea, with or without vomiting, photophobia, phonophobia, osmophobia, and postdrome. Thereafter, the pain subsides and patient feels tired. And this postdrome period can last for 12 hours to 24 hours approximately. Feeling tired or weary, difficulty with concentration, neck stiffness, these may be the usual features. Well, friends, we'll go to the 4F PQR, intense congestion of brain from delayed or suppressed menses, headache in place of menses, and then 4G is headache occurring after profuse uterine hemorrhage, rush of blood to head in pregnant woman, and PQR5, violent palpitation with throbbing in carotids, heart section labored, oppressed, blood seems to rush to heart and rapidly to head. So these are somewhat of classical presentation he has given in favor of the Glonine. So these collective features they point to premenstrual headache. Headache in women, especially the migraine, is related to changes in the level of estrogen. Level of estrogen drops immediately before the start of the menses, and premenstrual migraine regularly occurs during or after the time when the female hormones estrogen and progesterone drop to their lowest level. This migraine attack usually improves during pregnancy. However, some women might have been there who have reported that their migraine started during the first trimester of pregnancy. Then let us see what is the difference between menstrual migraine and other types of migraine. The menstrual migraine are triggered by the drop in estrogen. Other migraines may be triggered by stress, missing a meal, caffeine, or other reasons which can be emotional or environmental. Friends, we'll go to the PQR6, convulsions of children from cerebral congestion, meningitis during dentition, cases that seem to call for belladonna. So here this six sentence points to convulsions of children from cerebral congestion, and a febrile seizure is a convulsion in a child that may be caused with a fever, and the fever is often due to some infection. Febrile seizures occur in young, healthy children who have normal development and haven't had any neurological symptoms before. The symptoms are usually a child having a febrile seizure, he shakes all over and loses consciousness. Sometimes the child may get very stiff or twitch in just one area of the body. And if a child having a febrile seizure, he may have a fever higher than 100.4 Fahrenheit. He may lose consciousness. He may have jerks and shakes of the arms and legs. Febrile seizures most oftenly occur within 24 hours of the onset of fever and can be the first sign that the child is ill. We go to the convulsions of children from meningitis. Meningitis is a serious problem. It is inflammation of the meninges. The most common cause of meningitis are viral and bacterial infection. The symptoms of the viral and bacterial meningitis can be similar in the initial stages, and the symptoms are depicted in this particular diagram. We have fever, cold hands and feet. There can be vomiting. There can be patient is drowsy and difficult to awake. There is a confusion and irritability, severe muscle pain, pale, blotchy skin, spot or rashes can be there, severe headache, stiff neck, and the child dislikes the bright light, and convulsions and seizures can be there. There is a sudden high fever with a stiffness of the neck, severe headache that seems different from the normal, headache with nausea or vomiting, confusion, difficulty in concentration, seizures, sleepiness or difficulty in waking, and sensitivity to light. Skin rash, sometimes such as in meningococcal meningitis, can be there. Now, please remember that meningitis is a medical emergency and should be treated in a proper setup where the secondary or tertiary care hospital should be the right place to treat that condition. Now we go to the PQR8, and PQR8 tells the flashes of heat at the climacteric with catamania. So common perimenopausal symptoms include they are physiological, anger, anxiety, depression, irritability, dizziness, difficulty in concentration, fatigue, and mood swings are common. Physical symptoms include the hot flushes, night sweats, reduced libido, weight gain, urinary incontinence, vaginal dryness, and bloating. Friends, thank you very much for watching. Sharing is caring. Thanks once again.